So, hello students. Let us now discuss a very important MCQ topic, that's the mandibular nerve. Mandibular nerve. We've seen this mandibular nerve is a content of the infratemporal fossa. We've already seen this, right? Mandibular nerve is a content of infratemporal fossa. Now, this mandibular nerve is one of the branches of the trigeminal nerve, right? Trigeminal nerve gives three branches. One is the ophthalmic division, one is the maxillary division, and the third one is the mandibular division of trigeminal nerve. Now, this mandibular division gets out through a foramen of the skull. Come on, students, can you answer this? The mandibular nerve gets out through which foramen of the skull? Any guesses? Yes, very good, very good. The foramen ovale. Excellent. Very good to all of you. That's the foramen ovale. And you tell me now, students, the moment the mandibular nerve gets out through the foramen ovale, where is it lying? In. Come on, students. Come on, if you can answer this. The moment the mandibular nerve from the skull gets out through the foramen ovale, where is it lying now? In the infratemporal fossa. It lies in the infratemporal fossa. Did I not tell you this in the lecture of infratemporal fossa? One of the contents, mandibular nerve. Clear? Mandibular nerve. So have a look here, students. This mandibular nerve. Now look at this slide once again. What is this for the mandible? That's the one moment, I'll just change the color. That's the body of the mandible. That's the ramus of the mandible. We have removed the ramus. Now we are in the infratemporal fossa. You can see this nerve here. You can see this foramen here. That's the foramen ovale, and the nerve which gets out is the mandibular nerve. Mandibular nerve. Now, this mandibular nerve will have a main trunk. It has a main trunk when it gets out, and then it divides into an anterior and posterior divisions. Students, be very clear about the mandibular nerve. It has a trunk, anterior and posterior divisions. Anterior and posterior divisions. Fine. Now, students, when a cranial nerve, just try to understand the branches of mandibular nerve that we're discussing now. Now you tell me, what is this cranial fossa? That's the lesser wing of sphenoid. That's the petrous part of temporal bone. What is this cranial fossa? That's the anterior cranial fossa. That's the middle cranial fossa, and that's the posterior cranial fossa. Clear? Anterior cranial fossa, middle and the posterior cranial fossa divided by the lesser wing of sphenoid and the petrous part of temporal bone. Now, a nerve, understand the statement. A nerve, when it lies in the cranial fossa, whatever cranial fossa it lies, whether it's anterior, middle or posterior, when a nerve lies in the cranial fossa, it is supposed to supply the dura mater or the meninges of that cranial fossa. Clear? That means if the nerve lies in the anterior cranial fossa, it would supply the meninges of anterior cranial fossa. If the nerve lies in the middle, it supplies the meninges of middle cranial fossa, and same for the posterior cranial fossa. Clear? So now students, tell me, mandibular nerve is lying in which cranial fossa? The middle cranial fossa. Mandibular nerve is lying in the middle cranial fossa. And can you see this here? What is this foramen here? What is this foramen here? That's the foramen ovale. And the mandibular nerve gets out through the foramen ovale. The moment it gets out, it's right in the infratemporal fossa. Infratemporal fossa. Am I clear? So let me just draw this mandibular nerve for you, students. When it comes in the infratemporal fossa, what do we call this as? We call this as the trunk of the mandibular nerve, trunk. And then it divides into an anterior and a posterior division. That's the anterior division, and that's the posterior division. Anterior and posterior divisions. Clear? Now, what are the branches of the trunk of the mandibular nerve? It gives a branch here. It gives a branch here. Now, this mandibular nerve has to supply the meninges of the middle cranial fossa. Clear? Because it lies in the middle cranial fossa, it should supply the meninges of the middle cranial fossa. And this it should have done when it is inside the skull. When the mandibular nerve is inside the skull, it should have supplied the meninges. But we don't know what happens. We do not know exactly what happens. It is said that somehow the mandibular nerve forgets to supply the meninges when it is inside the skull. Now, mandibular nerve forgets to supply the meninges. So when it gets outside the skull, it suddenly realizes what? It had to supply the meninges. Now, what would the nerve do? What would the nerve do? Would the nerve go back to supply the meninges? No. No, the nerve won't go back, no. but the nerve would give a branch, right? The nerve would give a branch. Now, this branch would enter the skull through a foramen. Again, this nerve has to enter the skull to supply the meninges. Now, this foramen ovale through which the mandibular nerve comes out is already full. It's full with those structures, MALE. We'll study this later. So, the foramen ovale is already full. So, now this nerve, there's no place, there's no foramen to go. But wait, there's the foramen right behind the foramen ovale. What's that? The foramen spinosum. The foramen spinosum. So this nerve enters the skull through the foramen spinosum, and this is what we call as, any guesses, students? Any guesses? This is what we call as the nervus spinosus. Nervus spinosus. So what is nervus spinosus? It is a branch of mandibular nerve which enters the skull to supply the meninges of the middle cranial fossa through the foramen spinosum. We call this as the nervus spinosus, or it is going to supply the meninges. So the meningeal branch of mandibular nerve, or a nerve which goes in a reverse direction of the parent. Any guesses? Any nerve or artery which goes in the reverse direction of the parent nerve, what do we call this as? The recurrent branch. So we call this as the recurrent branch of mandibular nerve. Recurrent branch of mandibular nerve. So that's the first branch from the trunk. The second branch from the trunk is nerve to medial pterygoid. Okay, nerve to medial pterygoid. Nerve to medial pterygoid. Let me just write this down for you. Let me just write this down for you. So branches from the trunk. I'll just mention this for you. Branches from the trunk. One is nervus spinosus. Okay, you can fill this later. It enters the skull through the foramen spinosum and supplies the meninges of middle cranial fossa. Okay, it supplies the meninges of middle cranial fossa. Second one is nerve to medial pterygoid. Nerve to medial pterygoid. So this nerve to medial pterygoid would supply what? It supplies the medial pterygoid. Remember, students, medial pterygoid is the only muscle which is supplied by the trunk of the mandibular nerve. Trunk, that's a very important MCQ. Rest of the muscles of mastication would be supplied by the anterior division of mandibular nerve. Okay. Medial pterygoid is supplied by the trunk of the mandibular nerve. Remember, that's a very important MCQ. Clear to all of you? Okay. So that's the nerve to medial pterygoid which supplies the medial pterygoid. It supplies the medial pterygoid and it supplies two more muscles. One muscle is in the ear which tenses the tympanic membrane. Any guesses? This muscle is going to tense the tympanic membrane. Yes, that's the tensor tympani. Right, very good. And there's a muscle in the palate which is going to tense the palate. What do you call this as? The tensor palatii. Very nice, very nice. So this tensor tympani and tensor palatii would be supplied by the mandibular nerve, by the trunk of mandibular nerve through. It's not a direct branch, it's through. Yes, the nerve to medial pterygoid. It's through the nerve to medial pterygoid. So nerve to medial pterygoid supplies the medial pterygoid. In addition, it supplies the tensor. Okay, you can fill this later. Tensor palatii and tensor tympani. Okay, remember one thing, students. Remember one thing. This mandibular nerve belongs to the first pharyngeal arch. We'll study the embryology later, but we have got the first pharyngeal arch, and this mandibular nerve is a nerve of the first pharyngeal arch. So what are muscles are derived from the first arch would be supplied by whom? Mandibular nerve. Are you getting this? What are muscles derived from the first arch would be supplied by the mandibular nerve because mandibular nerve is a nerve of the first pharyngeal arch. So when we are talking about the muscles supplied by mandibular nerve, when we are talking about the mandibular nerve, indirectly what are we discussing? The contents of the first pharyngeal arch. Understanding this, that means which are the muscles in the first arch? The muscles of mastication, right? Very good. The tensor palatii, the tensor tympani. Yes, this also belongs to the first arch. Why? Because it is supplied by the mandibular nerve. Perfect. Just try to correlate like this. It would be very easy then. Perfect. Okay. So branches from the trunk to, one is nervus spinosus. Second is the nerve to medial pterygoid, which also supplies the tensor palatii and the tensor tympani. Excellent. Very good, students. You're very good. Excellent. Now come to the anterior division. Yeah, so it supplies, I'll write one more thing, tensor palatii, tensor tympani. Always make flow charts. Always make flow charts like this. So it is very easy to remember from MCQ point of view. Right? Okay, good. So anterior division. Anterior division, how do we remember this? Anterior division gives 3 muscular branches and 1 cutaneous branch. 3 muscular branches and 1 sensory branch or cutaneous branch. Now, the muscular branches would supply the muscles of mastication. They would supply the muscles of mastication. Which are the muscles of mastication? Temporalis. So, what is the nerve? So, what is the nerve? The nerve is deep temporal nerve. Deep temporal nerve. Second, masseteric nerve. Masseteric nerve. And third is nerve 2. Lateral pterygoid. Nerve to lateral pterygoid. Muscles of mastication. So which are the muscles? Temporalis. The nerve supplying the temporalis, deep temporal nerve, which is a branch of anterior division of mandibular nerve. Masseter, masseteric nerve. And the nerve to medial pterygoid. So these 3 muscles of mastication are supplied by the anterior division of mandibular nerve, whereas the medial pterygoid is supplied by the trunk of the mandibular nerve. Again, I'm telling you, this is a very, very important MCQ. Very good. Very good. So what is a cutaneous branch? This cutaneous branch, students, you remember we have done sensory nerve supply of the face. This much part is supplied by ophthalmic, this part is supplied by maxillary, and this lower part is supplied by mandibular nerve. We've discussed the branches of mandibular nerve here. The nerve coming out from here, supplying the skin over the chin. What was that branch of mandibular nerve? Buccal. There was a nerve which was supplying the skin over the auricle and the temporal region, auriculotemporal. And there was a nerve which was piercing the buccinator. No. The nerve does not supply the buccinator. It supplies the skin over the buccinator. Come on, guess this. Guess this nerve. This is a branch of mandibular nerve. It is sensory. It pierces the buccinator and it supplies the skin over the buccinator. Name of the nerve, the third nerve here. So mental, auriculotemporal, and the skin over the buccinator is supplied by whom? Buccal nerve. Buccal nerve. So students, don't get confused. There are 2 nerves by the name buccal. One is the buccal branch of motor nerve, which supplies the buccinator, which is motor. The second one is the buccal branch of mandibular nerve, which supplies the skin over the buccinator, which is sensory. Perfect. No confusion, students. This is all very, very important. Be clear about this. Good. Very good. So anterior division supplies 3 muscular branches, 1 cutaneous branch, 3 muscular branches to the muscles of mastication, 1 cutaneous branch. That's the buccal nerve. Perfect. Very good. Excellent. Now coming to the posterior division. Now posterior division is very important, students. Understand this. This posterior division gives 3 branches. Let me just write this for you. One is lingual nerve. Lingual. Second one is auriculotemporal, and third is inferior alveolar. Inferior alveolar. As dental students, this mandibular nerve is very, very important for you. Right? Perfect. So the first one is the lingual nerve, the second one is the auriculotemporal nerve, and the third one is inferior alveolar nerve. Let us understand this. Branches from the posterior division. That's extremely important. Extremely important. Okay, students, have a look at this. Right. Now you tell me, where are we? Where are we? Where are we? Where are we? What is this? We have removed the ramus of the mandible. Where are we? We are in the infratemporal fossa. What's this nerve? That's a mandibular nerve. What is this division? Look at this, beautiful. What is this division? That's the anterior division. That's the posterior division. That's the anterior and that's the posterior division. Oh, I mean, this is the anterior division. This is the anterior division. This is a small anterior division and this is a big posterior division. So these are anterior is a very small and posterior is a big division. From the posterior division, what are the branches? What is this nerve? That's the lingual nerve. What is this nerve? That's the inferior alveolar nerve. And what's this nerve? That's the auriculotemporal nerve. Auriculotemporal nerve. Can you see this? Yes. That's the lingual nerve which is coming down here to supply the tongue. What is this nerve? Inferior alveolar nerve, and that's the auriculotemporal nerve. We'll see this. We'll see this. So let us start with the first nerve, lingual nerve. Lingual nerve. I'll tell you this, then I'll show you the slide, so it is going to be easy for you. Lingual nerve. So what does this lingual nerve supply? Any guesses? The lingual nerve is going to supply the anterior 2/3 of the tongue. How do we divide the tongue? Anterior 2/3, posterior 1/3, posterior most part of the tongue, right? So who's going to supply who's going to supply the anterior 2/3 of the tongue? Sensory supply, lingual. So supplies general sensations. What is general sensations, bacho? What is general sensations? General sensations is touch, pain, temperature. General sensations. Okay, touch, pain, temperature is general sensations. And which are the other sensations? Special sensations. Very good. And which are the special sensations for the tongue? Taste. Very good. Taste. Excellent. You answered well. Taste sensation. Excellent. What does the lingual nerve do? It supplies general sensations to anterior 2/3 of the tongue. Supplies general sensations to the anterior 2/3 of the tongue. Now, this lingual nerve is joined by someone. Okay, who joins the lingual nerve? It is joined by, this lingual nerve is joined by Chorda tympani. Okay, this is Chorda tympani. This Chorda tympani is a branch of what? Facial nerve. Facial. Okay, so facial nerve gives a branch, that's Chorda tympani, which joins the lingual and supplies, yes, any guesses? Supplies special sensations. Special is taste to anterior 2/3 of the tongue. Clear? So just understand, tongue is a separate topic to be discussed. We'll discuss this later, but sensory supply of the anterior 2/3. General sensations, special sensation. General sensations is by the lingual nerve. Special sensations is by the Chorda tympani branch of facial nerve. So clear? Lingual nerve supplies general sensations to the anterior 2/3 of the tongue. Just have a look at this. Let me see the slide here for you students. Okay, look at that. So look at this. That's the lingual nerve. Look at this nerve. That's the lingual nerve. That's the lingual nerve, which is a branch of posterior division of the mandibular nerve, going to supply the anterior 2/3 of the tongue. And look, this lingual nerve is joined by someone. Look at this, beautiful students. Appreciate this nerve which is coming from the ear. And this nerve is a branch of facial. That's a facial nerve. The facial nerve in the ear gives this branch, and this branch gets out and comes and joins with the lingual. This arrow, that's the Chorda tympani. That's the Chorda tympani nerve, right? So this Chorda tympani is a branch of facial nerve, comes and joins with the lingual nerve in the infratemporal fossa, now goes and supplies special sensations, that's taste, to the anterior 2/3 of the tongue. Am I clear? Clear, students? Just to the point, I'm telling you what is very important from MCQ point of view. To the point. Perfect. So that's about the lingual nerve. Right. Now coming to the next nerve. Students. So lingual is clear. Now look at this nerve. What is this nerve? This nerve is a branch of the posterior division of mandibular nerve. This nerve is entering into a foramen here in the mandible. That's the mandibular foramen. So this is a inferior alveolar nerve because it supplies the inferior teeth, the lower teeth and the lower jaw. So inferior. Alveolus is the jaw. So this inferior alveolar nerve enters the mandibular foramen, supplies the lower jaw and the lower teeth. It emerges out from here. What is this foramen here? Mental foramen, right? So the nerve is now known as mental nerve. That's the mental nerve. So inferior alveolar nerve enters the mandibular foramen, supplies the lower jaw and the lower teeth, comes out as the mental nerve. Now this inferior alveolar nerve is the nerve where you give a block. You know this. That's the inferior alveolar block to operate on the lower teeth and the lower jaw. Perfect. That's the inferior alveolar nerve. Now students, before it enters the mandibular foramen, before it enters the mandibular foramen, it gives a branch. Look at that. That's the inferior alveolar nerve. And before it enters the mandibular foramen, look at this branch here. Look at this branch. This is the nerve to mylohyoid. Nerve to mylohyoid. And this nerve to mylohyoid supplies two muscles. One is the mylohyoid. This is the mylohyoid. And this is the anterior belly of digastric. So nerve to mylohyoid supplies the mylohyoid and the anterior belly of digastric, meaning these two muscles would be derived from the first pharyngeal arch. First pharyngeal arch. Don't get confused. Let me just write this down for you. Okay, fine. We'll just put this on the paper. So inferior alveolar nerve. Inferior alveolar nerve enters the mandibular foramen, supplies lower jaw, emerges out as mental nerve, right? Before entering the foramen, it gives a branch. What is the name of the branch? It gives a branch that's nerve to mylohyoid. That's the nerve to mylohyoid, right? And this nerve to mylohyoid is going to supply two muscles. It supplies, number one, mylohyoid muscle and the anterior belly of digastric. Anterior belly of digastric. Remember, students, anterior belly of digastric is supplied by the nerve to mylohyoid, which is a branch of mandibular nerve, whereas posterior belly of digastric is supplied by facial nerve. These are two different bellies of digastric derived from two different sources, so the nerve supply is different. Anterior belly of digastric is supplied by the mandibular nerve because it is derived from first pharyngeal arch. Posterior belly of digastric is supplied by the facial nerve because it is derived from second pharyngeal arch. Just remember that. Perfect. Clear? So inferior alveolar nerve is clear to all of you. Just have a look at the slide. Have a look at the slide. That's the inferior alveolar nerve. Enters the mandibular foramen, supplies the lower jaw, lower teeth, emerges out as mental nerve, supplies the skin here. Before entering the mandibular foramen, it gives a branch here. Look at that. And what is this nerve known as? That's the nerve to mylohyoid. And this nerve to mylohyoid supplies the mylohyoid and the anterior belly of digastric. Perfect. Now coming to the last nerve. The last nerve is the auriculotemporal nerve. Now students, if you can see this slide, this auriculotemporal nerve arises as two roots. This is one root, this is another root. And these two roots then join to form the auriculotemporal nerve. And these two roots are going to enclose an artery within them. That's a very, very, very important MCQ. The two roots of auriculotemporal nerve encloses an artery within them. Look at that. This is an MCQ. This was already asked in the AIMS. The middle meningeal artery. So the two roots of auriculotemporal nerve are going to enclose the middle meningeal artery. Now this auriculotemporal nerve, we know this, supplies the skin over the auricle and the temporal regions. It supplies the skin over the auricle and the temporal regions. Perfect. Clear to all of you? Okay, so just have a look at this. I'll just write this for you. Auriculotemporal nerve. That's the auriculotemporal nerve. Supplies, emerges as two roots. This is a MCQ. Emerges as two roots. Enclosing the middle meningeal artery. Remember this, enclosing the middle meningeal artery. So it emerges as two roots, enclosing the middle meningeal artery, supplies skin over, supplies the skin over the auricle and temporal regions. Supplies the skin over the auricle and the temporal regions. Right? Now, another very important thing, just try to understand this. It also carries postganglionic. It also carries the postganglionic parasympathetic fibers. It also carries the postganglionic parasympathetic fibers from otic ganglion. Now, what is this? I'll tell you later. Otic ganglion to parotid gland. Okay, it also carries the postganglionic parasympathetic fibers from the otic ganglion to the parotid gland. Now, what are these ganglions? What are these glands? This is all parasympathetic nervous system. But just remember, the postganglionic parasympathetic fibers from the otic ganglion to the parotid gland are carried by auriculotemporal nerve. We'll see this later. So this auriculotemporal nerve arises as two roots. Look at these two roots. Appreciate these two roots. And which is the artery enclosed within the two roots. Middle meningeal artery supplies the skin over the auricle and the temporal region. It also carries the postganglionic parasympathetic fibers from the otic ganglion to the parotid gland. Clear, students? I'll just quickly go through this mandibular nerve for you once again. But before that, if you can answer this MCQ, look at this. Branches of anterior division of mandibular nerve is. So such type of MCQs you'll be get meningeal branch. Yes, meningeal branch arises from trunk of the mandibular nerve. That's the nerve to nervus spinosus or the meningeal branch of mandibular nerve. Masseteric nerve is anterior division. These two are from the posterior division. So what is the answer here? Answer is masseteric nerve. Masseteric nerve. Clear? Nerve related to the third molar tooth. Now students, this is a very commonly asked MCQ in the entrance exams. What a student, when the student looks at this MCQ, nerve related to the third molar tooth, the first answer which clicks to our mind is inferior alveolar nerve, right? But that's not that's not the answer. That's not the answer. Inferior alveolar nerve enters inside the mandibular foramen. It's deep inside the mandible. It's deep inside the mandible, right? The nerve related to the third molar tooth. Let me just see this. Okay. So the nerve related to the third molar tooth is this nerve. What is this nerve? What is this nerve? Any guesses? That's the lingual nerve. Lingual. Remember, the nerve related to the third molar tooth is going to be the lingual. It's not inferior alveolar. So the nerve related to the third molar tooth is lingual nerve. Remember this. This would be asked in the exams. Clear, students? So today in this lecture, we have discussed the mandibular nerve, a very, very important MCQ. I'll just quickly recapitulate this. Mandibular nerve is a branch of trigeminal nerve, gets out through the foramen ovale, lies in the infratemporal fossa. It has a main trunk and two divisions, anterior, posterior. Branches from the trunk. One is the nervus spinosus or the meningeal branch of mandibular nerve, or the recurrent branch of mandibular nerve, enters the skull through the foramen spinosum, supplies the meninges of the middle cranial fossa. The second branch from the trunk is the nerve to medial pterygoid, which supplies the medial pterygoid to more muscles, tensor palatii, tensor tympani. Anterior division gives three muscular, one cutaneous branch. Muscular branches, masseteric nerve, deep temporal nerve, nerve to lateral pterygoid. Sensory branch is the buccal nerve. Supplies the skin over the buccinator, not the buccinator. Buccinator is supplied by buccal branch of facial nerve. Posterior division gives three branches. One, lingual nerve, supplies general sensations to anterior two-thirds of the tongue. It is joined by Chorda tympani, a branch of facial, which supplies taste sensations to the anterior two-thirds. Second is inferior alveolar nerve, enters the mandibular foramen, supplies the lower jaw, emerges out as mental nerve. Before entering the foramen, gives a branch, nerve to mylohyoid, which supplies the mylohyoid and the anterior belly of digastric. The last one is the auriculotemporal nerve, arises as two roots, encloses the middle meningeal artery, goes up, supplies the skin over the auricle and the temporal region, also carries the postganglionic parasympathetic fibers from the otic ganglion to the parotid gland. Now, students, if you know this mandibular nerve well, you know most of the part of the head and neck, because many things are supplied by mandibular nerve. Also, mandibular nerve is a nerve first pharyngeal arch. So what are muscles supplied by the mandibular nerve would be derived from the first pharyngeal arch. Namely, number one, the four muscles of mastication. Second, the tensor pallidi and the tensor tympani. And which are the ones left? The mylohyoid and the anterior belly of digastric muscle. Clear? So all these muscles are derived from the first arch, and because they are derived from the first arch, they are supplied by mandibular nerve. Perfect, students, perfect. What do you say? Any doubts? Any doubts? I hope this lecture is clear to all of you students. In case of doubts, do get back to me. Thank you. Thank you till then. Thank you. And happy learning. Thank you.